Hey guys, today I am going to get some more nose filler. I mean, I've had nose filler a couple times before, so this is nothing new to me, but I thought I would take you guys along with the process because I find it really fun. Of course, if you are under 18, then please, take this with caution that I'm not trying to tell you that you need this. I personally am just wanting to get it myself, and I'm documenting the experience for any other people that are interested, and I just want to make sure that if you guys are going to get it done, then you go to someone who does it properly and knows what to do if things go wrong, and just make sure the whole process is totally safe. Yesterday I actually went to where I'm getting my filler done, although I did not get any filler. So basically, when I did some filming a while ago with a company that's called FVCE. I think it's just pronounced like face, but I don't want to butcher it. So anyway, so I did some filming with them a while ago, and they invited me back yesterday to film just a few little clips for their website, which was really cool, really fun experience, so thank you guys. And then they said that they would fit me in with someone to get my nose topped up, so I'm very grateful for that. And yeah, I thought I would just bring you along for the experience. So I am seeing Dr Roshan. I'm very bad at pronouncing things. I really hope I'm not butchering any of these names in this video. If I am, feel free to just go at me in the comments. But yeah, I'm really excited. I don't really need a whole lot. As you can tell, my nose is not too bad. It's like not as bad as how it was before I got any filler at all. I think I last got filler in December of 2019, before COVID. So I have a high metabolism, so filler lasts me quite a long time, so around 2 years each time, and even then I don't need a huge amount. So I will put some before and after pictures throughout the video, but I'm going to put a picture here in a second. Hopefully I can find one of my nose actually before filler, and then let me just turn this way so I can put the picture side by side. So I don't need a huge amount, but yeah, I just want a little bit extra. And now that I've had laser eye surgery as well, my glasses don't hide my bump, so my nose is just it's fully visible, so yeah, I'm really excited. So you guys are going to come along with me on my journey. Guys, I have no idea what to wear today, right? I don't know if it's going to be hot, I don't know if it's going to be cold. The lighting is awful. I also have had chin filler before, only once, and it actually made quite a bit of a difference. So my jawline is quite like alright, but in some pictures it's quite like double chinny. Like in my last video, god, my double chin was like awful. Like I don't even know what happened with that. And I've never had lip filler. People always think I'm lying. I've never had lip filler. So we're having construction work done, so if you can hear that, just please try and ignore it. So I've just done my makeup, just put my hair in rollers, because I've been using rollers lately on my short hair because I've taken my extensions out, because on Tuesday I am going blonde. I'm getting a little bit nervous, only because I've kind of forgot what I'm meant to be doing like beforehand. Because I don't know if you saw when I did my makeup, I actually put makeup on my nose, and once I realised, I was like, oh shit. So I kind of like wiped it off a little bit of micellar water, so hopefully that's okay. But I forgot what like the before care is. Like he'll tell me the aftercare, I hope. But I forgot, so I'm like, shit. Anyway, let me just show you a proper before. Hopefully that is good. Okay, so we're almost here. It is insanely hot. Everyone keeps staring at me, so I'm going to put my camera away in a second.
My name is Dr Rhoda, and I'm going to do your non-surgical rhinoplasty today. So what we can do is I'll go through exactly what it means, what to expect, the side effects and the common risks involved, and the aftercare as well. If you have any questions throughout, feel free to stop me and we can go through it. Okay? Anything that you want to ask before we start?
I did put a little bit of makeup on my nose, then I realised and I wiped it off. Is that okay?
That's absolutely fine.
Okay.
So before all of the procedures, I always wipe the area with an alcohol wipe, and that kills off any bacteria, just makes it safe for the procedure.
Yeah.
Okay. So we're doing non-surgical rhinoplasty today. The product we're using is Juvederm Ultra 4. It's a very thick substance. It's made of hyaluronic acid, which is what our skin is naturally made out of. So as we age, that sometimes depletes, and then that's when we use things like filler for nasolabial folds, so the lines here and the marionettes. So we fill that up, and that prevents the sagginess that happens as we age. The other good thing about it is we can use it to structurally change someone's face in order to look more objectively beautiful. So that's things like jaw filler to give you more of a cut jaw, and chin filler to harmonise the side profile. In this case, we'll be using non-surgical rhinoplasty to straighten out any bumps in your nose and perhaps lift the tip as well.
Yeah, I love the tip lifted. I think it looks so cute.
It does. It looks lovely. It's really what's in recently. And in different cultures, there's different ideas of beauty. So I know that in a lot of Eastern cultures, they have a little sloped nose, and some people like it completely straight. So what would you like to have done today?
I feel like they call it the ski slope, for it kind of flips off at the end.
Yeah.
I like that kind of thing. I mean, I've got a little bump at the top, so if we can straighten that out and then like the slick.
Of course, no problem. Yeah, we can definitely do that. So as I was saying, it's made of hyaluronic acid, which is what our skin is naturally made out of. It's really good because it pulls in water, it pulls in antioxidants, and it pulls in nutrients. So it's actually a very good, rigorously tested medical product. So that's what we'll be using today. It's from a Wigmore pharmacy. So that's non-surgical rhinoplasty in sort of a nutshell, and that's what we're going to be doing today. We can go through the side effects.
Yeah.
So whenever we use a needle, there's always a risk of infection, bleeding, and bruising. Now bleeding, if there is any, it's quite uncommon with the nose, but we simply just press on it with some gauze and it will stop. Bruising, also uncommon with the nose. All you need to do is put some arnica on, and then it should disappear within 2 or 3 days. And infection, as I said before, I'll clean the area with an alcohol wipe. And then after that, I also use a sterile technique by using sterile gloves and not touching anything when I actually do the injections. Okay? The fourth thing is an allergy. It's always a possibility. What I'll be doing is patch testing you. So before we do any procedures, I'll put a little bit of the filler on your hand, and then we'll monitor it to see if there's any sign of infection. Okay. Any questions so far?
No.
Great. So the last thing I really want you to be aware of is something called vascular occlusion. Now it sounds quite scary, but as long as you're with a medical professional who knows facial anatomy very well, I'm sure we'll be absolutely fine. What it is essentially when an injector puts filler into an artery or a vein by mistake. Obviously you can't see where you're going, so if you put filler into a vein or an artery, it blocks up the blood supply to the nose, and that can manifest in things like severe pain, colour changes, and eventually tissue necrosis, which basically means that the tissue is dying because it's not getting enough blood or oxygen. So it all sounds very scary. The good news is it's very, very manageable. If you were to have any of the symptoms I just described, you would call me, and you would come back to this clinic, and then we would dissolve it for you with a substance called hyalase. So you know how I was saying before, hyaluronic acid is what we use?
Yeah.
We have a specified product which can dissolve it right in front of your eyes. It's a fantastic product. So the chances of that happening are extremely low, particularly because I'm avoiding all of the arteries and veins in the nose by staying within the midline.
Yeah.
But there's always a possibility. Everyone's facial anatomy is different, and it can happen to anyone. The most important thing is you come to a medical professional today where I've been trained in facial arteries, so I know where they are, I can do my best to avoid it, but even if you do get it, we can simply dissolve it for you. Now in terms of aftercare, it's important for the rest of the day to avoid makeup in the area. You need to avoid alcohol, unfortunately. But the good news,
I don't drink.
You don't drink anyway?
No, I don't drink at all.
Excellent, excellent. So no worries for you there. And even better news, no exercise for the next 24 hours either. So it's always a nice balance between the two. So no exercise, no alcohol, no makeup. I'd like you to stay upright as much as you can for the next 4 hours.
Okay.
And for 2 weeks, no facials and no saunas because that can distort the filler in that area. How did that even happen?
How did that happen? Oh my god. Do you want me to move my hair?
No, it's okay, don't worry. And I'll clean everything afterwards. It just helps absorb it all. It's not too painful, these injections. There's a couple of ones are a little bit tender, so just I'm going to pop it under here.
I think I remember that one being
the
worst one.
Yeah.
It's nice to have a clinic in Mayfair.
Yeah.
I might continue seeing some patients there actually. It's nice to have a spot in London where I can kind of rent it as and when needed.
Where do you normally go then?
The clinic in Windsor.
Oh, okay.
But then I also work with a few clinics, established clinics like Therapy Clinic, you ever heard of them? So there are clinics throughout London, about maybe 10 of them. And then I have my own private clinic in Windsor, and building up around the Berkshire area.
Very busy then.
Very busy, yeah. I also work as an A&E doctor as well. So
do you?
I do, yeah. So very busy.
Very
But I like being like that, I think.
So when I had chin filler last time, they didn't put any numbing cream on because they said
They're
that it doesn't really touch.
It doesn't really, yeah.
No,
because
it didn't hurt.
you're going straight in. It's the same with the nose. You're going straight in. The only time we really use anaesthetic cream is for the lips, because you're doing multiple injections, sometimes well over 20, and you're doing on the most superficial layer. Sometimes, yeah, depending on what type of lips you're looking for, sometimes you can go up to 20 times. And in terms of needle in, needle out, that sort of thing.
Horrible.
Yeah, luckily for you, you don't need it at all. So with chin, you'll be absolutely fine. The other good thing is the fillers that we use here, they have anaesthetic built into it. So the more injections I do, the actually the easier it'll become. Yeah, no, you have really because you have a really nice cupid's bow as well, good definition and good volume. So good for you. A lot of people pay good money to get what you have. So your hump really isn't too big here,
No,
actually, if at all. So I'll just put a very small amount in here, and then we'll go for this injection, and then this one to lift the tip. Okay?
Yeah.
You ready to go?
Yeah.
Right. Okay, so what we've done is lifted up the tip, and there is a ski slope there. Now I'll show you some pictures and you tell me if you like it, or we can straighten it out for you. So we've got that ski slope experience where you're just slipping up.
Oh yeah, it does, yeah.
Because you had that naturally, actually. I didn't do that, it's just that by, yeah, it's just by doing the tip by itself.
Oh no, I think that's great.
Good. But I think chin filler will work quite nicely before you now as well. But now doing the chin filler will help harmonise everything as well. So we're going to put 2 injections just here, and then we'll help bring it out a little bit, and we'll do that. It's a good thing you know Cameron then, eh?
Yeah. I thought he was here today, not
he
with us.
He will be here later, yeah.
Oh,
he will be here later for one of my other clients, but because he's already had you in one of the videos, it looks a bit odd to have you from multiple.
So many times, it's like a little twin or something.
It's exactly the same thing. Exactly the same thing. Well, the good thing is you have my number, so if you have any problems at all, you let me know. I really do want you to look out for those symptoms I told you before. Searing pain, colour changes, that sort of thing.
Got it on camera anyway, so.
Absolutely. I think we've actually had a good amount. I think any more, I used all of the 0.7 mil that was left. I think any more than that. Because the good thing about this filler is that it brings in water. So what you're seeing now, it will increase a little bit over the coming days. Hi, you're right.
Yeah.
Perfect. Well, we're all done. You want to sit up?
Yeah. Thank you.
Shall we take some pictures as well from the side view?
So I'm home now. So obviously I'm gonna be really swollen. I still have swollen. Why did I say it like that? Swollen. Am I saying that right? Anyway, obviously I'm gonna be swollen. So I've got like blood on my cheek and stuff still. Because obviously I'm trying not to touch my face, so I'm just kind of leaving it there. So I'm gonna do check-ins like tomorrow. And maybe the day after, just to kind of show you how the swelling goes down a little bit. So this is how we're looking right now. I mean, I wasn't like thinking that I really needed chin filler, but then when we looked at when I had chin filler, I can't speak. When we looked at when I had chin filler before, it actually did make quite a bit of difference, and we were like, sure, go for it. So I think it's just gonna really make my jaw look even sharper, even though we didn't put anything here, it was all in the chin. It just kind of balances the profile. So yeah, my nose, I absolutely love my nose. It's got that like ski slope swoop that I like. And the chin, I'm actually very glad I got it. I really like it. I had quite a bit of filler like kind of left over from last time, and that was like in December of 2019. So because I have a high metabolism, filler lasts quite well on me, so I probably won't need anything done for another like 2 years. Yeah, let's show you properly. So I'm having my hair done on Tuesday, which I'm so excited for. I feel like I'm going through like a hot girl summer transformation. We love to see it. So I'm going blonde on Tuesday. Anyway, so this is my update for now. Maybe I'll show you tonight or tomorrow morning. I'll see if there's any changes. Okay guys, so it is currently 10:47 p.m. so I'm getting ready to go to bed because I have work tomorrow. I just took the rest of my remaining makeup off. My chin is kind of coming out like bruised, and it is a little bit sore. Like when I talk, I feel like I'm talking a little bit like weird with my face, but I had that last time, so I think it's normal. I hope so. But I just can't stop looking at my nose. Like genuinely, this is, if I was to get a real nose job, this is how I will want my nose to look. Like, I can't speak this evening, I don't know why, but this is how I would want my nose to look like from the side. I'm not going to upload this video until like I've got a few days worth of footage of like updates, so it's just fair to show you how it looks. So obviously right now this is not the final look because it's swollen, but I still really like it. So here's this side, and then we have this side as well. Good morning guys, it is the next morning, and last night my chin was a little bit sore, but it's feeling a lot better now. I feel like I was talking a little bit weird, but now it's okay. It's still a little bit like bruised and marks and stuff, which is totally fine. My nose is looking great. Here's the other side. Hey guys, so I just started work. It is the next day. So although I've just started work, I've just thought, oh my god, I haven't updated you guys. So again, not a huge update to give you, so I'm just gonna kind of turn to the side so you can see the difference. So it's definitely, the swelling is definitely going down. The marks on my chin are also going down. He did say I could put some arnica cream on it, but I don't have any. Yeah, I really love it. The chin is actually coming out even a little bit more, which is what's meant to happen. He said in our like video, I don't know if it cut off at this point, that it gets better over time. So yeah, I really love it. Again, absolutely love my nose. My hair, I know, I totally forgot to update you guys, I'm really sorry, but I have had my hair done, as you can tell. Let me just shut the window because I feel like loads of flies are gonna come in because it's hot. But yes, I can't believe my hair. I literally am obsessed with it. I think it looks so good. But yeah, in case anyone cares about my hair, my filler, it's really like, it feels absolutely fine now. My nose a little bit, when I touch it, it's a little bit like, ooh, you can kind of feel that something's a bit sensitive. And here's this side. So I think this is going to be my last update, just because I think the swelling has gone down quite a lot, and it kind of looks similar to how it did yesterday or whenever I last updated you. So I think that's it for the vlog. I hope you guys enjoyed coming along with me to get my nose filler. If you'd like me to do like an updated video maybe in like a few weeks time, or even like a frequently asked questions, a Q&A about filler, then please ask your questions down below, or just let me know that you want me to do that video and I will go ahead and do that for you. I have done something like that in the past. I just feel like it needs a bit of an update. So yeah, if you want that, give this video a thumbs up, let me know in the comments. Don't forget to hit the red subscribe button and the bell if you don't want to miss any of my future videos, and I will see you guys soon. Bye. I can't believe how insane my hair is. I literally am obsessed.